And basically, I'm a person who's living alone and has had a kind of surgery, and I was looking for kind of a nursing care. I had this unique problem where after my surgery, and I think they probably had to put 1,000 drops in my eyes every day, and ointments and things like that. And I'm on a terrible patient, and I couldn't do it myself. So when I talked to the N.O.R.M. people, they said, well, fine, that's a great thing. We have set up this organization, and nursing care is one of the services that we provide. And that's how it came to using N.O.R.M.S, and they send their people, and I was really impressed with the kind of staff that they send, their professionalism, their care, their approach to things. It was a fantastic experience. And it so happened that about a couple of weeks later, my elder sister and brother-in-law live here in Ananagar, and they're also an elderly couple, and they needed some help in terms of visiting doctors. And again, I approached N.O.R.M. and they said, in fact, their son lives in Delhi. He met with the N.O.R.M.S people. They sent one of their doctors there, and they were tremendously impressed. It is not so much of the doctors there, I think, are generally good all-rounders in the sense they not only are able to identify the issues and all that, and other than most people kind of recommending, go for a scan or this or whatever, they were able to go to the roots of the problem. And in many cases, I think the issue, especially with elderly people, is more the state of the mind. They're living alone, their children are overseas, and kind of a support system is not there. So when they call for a doctor, it's more for a kind of thing rather than a specific ailment. So I think that's where I think N.O.R.M.S has done a fantastic job. They're able to identify the root cause of the issues and come out with a recommendation. My specific experience was with the nursing care, and again, in the sense that, and especially it was eye-related. So they sent people who had kind of some experience in that area. So they were able to, allay some of my anxieties that what I thought was kind of unique to myself was something that they said was typically this happens in all people who have these eye surgeries. So from that standpoint, they're able to kind of communicate and give you a comfort feeling. And they would also tell you, it's like, okay, you need to accept the fact that it's going to take 3 weeks, 4 weeks, 5 weeks, etc. And so something they gave you kind of a comfort feeling. And what my sister reported to me a couple of weeks ago is, especially the doctors that went there, I mean, she had felt very uncertain after having a fall while coming on a flight from Bombay to Chennai, where she had gone for some condolence visit. Till that fall, she was absolutely okay. After that, it was a case of vertigo, but more than the vertigo, it was the kind of the anxiety and things like that bothered her. And the doctors here were able to identify, most of the other doctors said it's vertigo, take tablets for that. But whereas the professionals here, the doctors here were able to go into a little more details and understand her problems rather than just treat her for that specific part of it. It so happened that vertigo is only 20% of the problem that she's having, 80% of something else. And the doctors here were able to identify that 80%. So I would, without any hesitation, recommend N.O.R.M.S to anybody who's looking for nursing care, also looking for doctors on call. I think they're a fantastic organization to go to.